What's up guys, welcome back to my channel, and hi, if you're new here, my name is Linda and welcome to the Fun Pharmacist. In this channel you all know what we do, fun stuff, health stuff, and today it's a very special video. I'm serious today, yeah? So today I have a special guest. She's a pharmacist. She's going to introduce herself and we're going to talk about a very special topic. So guys, stay tuned. So welcome Daktari, you can introduce yourself.
Hi guys, my name is Dr. Susan Yabate Mageto. I am a clinical pharmacist in training in my second year of training. I'm also a lecturer at Mount Kenya University, and I also run an anticoagulation clinic at Fortis Suites just next to Kenyatta Hospital.
Wow guys, what an introduction. You see, I always tell you pharmacists are out here doing great things. Now I'm Niamini, so this is an example. And today we're going to touch a very special topic. You've seen me talking about vaccines, and people have been asking me, why are you telling us to get vaccinated? Yes, these vaccines are causing people to have blood clots. So today we're going to address that issue and we're going to just actually tell you more about it. So stay tuned. And if we can start, what is a blood clot, Doctor? You can just tell us what a blood clot is and how it comes about.
Okay, so in layman's terms, a blood clot is what is formed at the end of the hemostatic process. Usually there's a vasoconstriction that happens when you, let's say, get injured. A blood vessel first gets injured, yeah? And when it gets injured, then what happens is there's a platelet plug. Your platelets, the platelets in your body, they form a plug, which is like a temporary plug in order to stop the bleeding, yeah? And when that happens, now if the platelet plug is not sufficient in stopping the bleeding, then there's what we call a coagulation cascade, which is being activated now. So it's activated, and that is how you end up forming what you call a thrombus, and that is what you call now a clot. Yes.
So in simple terms, she's used some technical terms, but in simple terms, yeah, but she's tried, yeah. I know, in simple terms, a blood clot. You see, when you've injured yourself, for example, umejigonga or something, so a blood clot is usually formed in order to actually stop you from bleeding. In simple terms, that's it. Yeah, so we know blood clots are actually good, and sometimes they can be very bad.
Yes.
Yeah, so in this case you're going to talk about the bad side of the blood clot.
Okay.
Yeah, and let us look at what factors usually predispose someone to actually getting the very bad blood clot.
Yeah, so as we said, when you're talking about the definition of what a blood clot is, when you form the thrombus, when you're bleeding, then it actually does a good job. It stops the bleeding. But now in this case, you'll find that there are people who have what you call hypercoagulable states, yeah? And now, instead, this potentially good process now starts forming where? In your blood vessels, yeah? And that is now how it comes about, that now you have a blood clot that is now bad. So some of the risk factors here will include now these hypercoagulable states, yeah? And this is where we'll have now pregnancy is one of them. Then we have people, if you have had surgery, it's one of them. Another one is immobility, yeah? That one is also a factor. Then you also have genetic predispositions such as deficiency in protein S, deficiency in protein C, yeah, and even factor 5 Leiden, yeah? So there's some risk. Those are some of the risk factors. COVID-19 is also actually one of the risk factors of getting clots, yeah. Yes, it has been one of the risk factors.
Okay, so when it comes to immobility, guys, I always tell you, please do your exercises. You always see me every day, I wake up, I run. And you see, we live in a society whereby people don't exercise. Yeah, we are usually having this lifestyle that is actually not good. Because you see, you wake up in the morning, you go to the office, you sit in your car, you go to the office, you sit in office all day. And then after the office, you eat your lunch. Maybe you're eating your lunch at your desk. You don't even move about. Or maybe your office even has a lift. Press the lift, go to the lift, get into your office. After that, go home again in the same car, cook, eat and sleep. You see, that's a very sedentary lifestyle, and it can actually predispose you to getting
Clots.
Blood clots. Another thing I think is hormonal contraceptives.
Yes.
Yeah, so you can touch a bit on contraceptives.
Yeah, so estrogen containing, especially estrogen containing contraceptives will actually, or even medications that contain estrogen being used for treatment of other diseases will actually predispose you to blood clots.
Yeah.
Other conditions also cancers, Cancers are also a major cause of risk factors, let's say risk factors of developing blood clots.
Yes. Now that we've looked at the factors that actually predispose you to getting clots, now let us look at, you mentioned COVID-19. Let us look at COVID-19 vaccines and their relation to blood clots, because that's what people are asking me, like, hey, you're so good at telling people to get vaccines, and we are reading on the internet, she says the power of Google. People are reading like, in America, these people have been found, they're put on Johnson & Johnson, AstraZeneca, and then they have blood clots.
Yes.
So why are you bringing us this vaccine? Why are you forcing us to actually get the vaccine? So let us look at the incidence and then the relationship, and then we can take it up from there.
Okay, so I start with the incidence. Yes? The incidence of blood clots, in the people who've been vaccinated. Currently, the data that is in is that we have, it's very rare. First, it's very rare, extremely rare. Because we've had people in, the studies that have been done on AstraZeneca is actually 1 in around 26,000 to 100,000 people who've been vaccinated have actually gotten blood clots. Then we've also had, for Johnson & Johnson, I think it was 1 in 533,000. People who actually got blood clots afterwards. So the incidence is extremely rare.
Now we've looked at the incidence, and guys, see, it's extremely rare. And if you want evidence, in my description box, guys, I'll go and look at the studies, and then I'll link them down below. You can go and read about them, so that you're actually convinced to go and get the jab. That is my work here. Anyway, now that we've seen the incidence, let us look at now how these vaccines and COVID-19 are actually linked to causing blood clots. Okay,
so what you need to understand is that how they actually cause blood clot is still something that is under study. It's not well understood. But since there's heparin, which is an anticoagulant, there's what we call heparin induced thrombocytopenia. So, okay, I think I need to go back and state that the kind of thrombosis that we experience in COVID, in vaccines, especially the COVID-19 vaccines, is what we call VITT, vaccine-induced immune thrombotic thrombocytopenia.
I'll write all that word here, so that some of us,
so that people understand, Then what happens is this now, when you have, this VITT is what we call it, or we term it, is closely related or similar to what we see in heparin-induced thrombocytopenia. And there are 3 types when you're talking about HIT, that is heparin-induced thrombocytopenia. And the first one is the classical one, the other one is the autoimmune one, then the third one, spontaneous heparin-induced thrombocytopenia. So it's similar to VITT, and that is what they're using to actually learn about the VITT. Now, how does it come about? One is spontaneous. There's a production of autoantibodies. These autoantibodies, they are produced against what we call platelet factor 4, which actually is used in the activation of what we call activation of thrombosis or coagulation. So in this case, you have these autoantibodies forming, and this is IgG, immunoglobulin G. Immunoglobulin G, and that is what basically now predisposes this patient to what we call thrombosis in this case.
So I know the process is complex, and you can use Google, guys. You can go and read about it if you don't understand. Too bad, but in simple terms, that's what she explained. So now we've looked at how it actually occurs. Now, if someone has been vaccinated, for example, I've been vaccinated today, and how will I know that I am actually developing a blood clot? Yeah, because you see, for me, like I cannot be able to actually know that I am developing that clot unless I see some signs and symptoms. Yeah, so can you like actually take us through those signs and symptoms, such that if someone has been vaccinated, then they experience those symptoms, it's good they go back to hospital, then they arrest the situation when it's still at the early stage.
Okay, so what you need to note is that the symptoms will depend on the site. Yeah, the symptoms will depend on the site. So if you're going to have a clot in your head, then or in your brain, what we expect is you have headaches, you'll have visual changes such as diplopia, that is you're seeing double vision. Then there's vomiting. If the clot is in your portal vein, we expect to see things like abdominal pain, abdominal clamping. If the clot is in your pulmonary system, then we expect to see you having problems breathing, etc. If you're having a DVT, then we expect you to have swollen legs, a bit of pain in your legs, and that is basically depends with the place, the site.
So in short, immediately after vaccination, if you notice these signs, please go back and report. And that is why it's good, like after vaccination, they usually tell someone to sit there for some time before they leave. And let me just ask, after how many days does someone actually, after how many days do those symptoms come about?
Okay, so you've talked about one thing that is very good, that immediately after you get your vaccine, at least 1 hour or so, you're supposed to sit around so that they can see if you have any allergic reactions. No, those are the spontaneous ones. But when it comes to the VITT or the clots that you're talking about, then you're talking about from day 5 to maybe day 30. So studies have shown that usually between day 5 to 15, then if you start experiencing these symptoms, then probably you're having a what? A blood clot, and it actually can be ascribed now to the vaccine. But below 5 days, usually that won't be. It might not be the vaccine.
Yes, for example, like when I had the vaccine, I had a headache. So you see, someone can say, I'm having a headache, so this is a clot, let me rush. So there's a time frame upon which you're supposed to actually see the onset of those symptoms.
So sure. So there's they use what we call the 40s to actually ascribe and say that this person is having a VITT, and it's probably because of the vaccine. So usually it's like they'll check the thrombocytopenia, and they'll be able to see the number of platelets you have. So
thrombocytopenia is low platelet.
It's low platelet count. Yes. Then there's also now the timing, as you've said. If you develop a clot and the timing is between 5 to around 30 days, then probably it might be the vaccine. And then there's also now the thrombosis. If they can be able to actually check and see if you have a clot, either by checking the D-dimer levels and be able to see that this patient actually has a clot. And the last thing they actually check is there any other let's say comorbidity that can actually have caused the clot. And if there's none, then and your score, that 40 score, if your score comes to about 6 to 8, then they will say that actually that vaccine is the one that
is causing that. So there's also a criteria. You know, there are people who are actually predisposed to getting the blood clots. For example, if you have cancer, for example, if you're immobile, if you're pregnant, if you're those risk factors that we talked about. So most likely they'll have to rule out those factors before they actually conclude that this clot is because of the vaccine. So now we've looked at the signs and symptoms. Now, is it advisable, because someone asked me, like, is it advisable, like, after I get the vaccine, I'm discharged, like, with anticoagulants? Because I don't know whether I am at risk. So supposing I'm a patient, I come to you, like, I've been given the jab, and I want to go home with an anticoagulant just in case, because yeah, I care about myself and I'm being like careful. So can you comment something on that?
Okay, one, as I said, the chances are extremely rare.
Yes.
So expert opinion has it that there's no indication for preventive anticoagulation after the vaccine. But if you were on anticoagulation before because of another condition, then you can actually continue with your anticoagulants. Yes. Yeah. So you do not need to take an anticoagulant after the vaccine. Yes.
So guys, please don't come asking me for anticoagulants. We will not give you any anticoagulants unless we assess you and see the risk. And don't go to pharmacies and harass people and tell them, oh, I need an anticoagulant because I've taken the jab. Because there's a risk to those anticoagulants.
Yes.
Maybe we can just talk about now the risk of a self-medicating anticoagulant, and then we can conclude.
So of course, the highest risk of anticoagulants, as we know, anticoagulants are what we call blood thinners. So the highest risk of taking anticoagulants is actually bleeding. Predisposing yourself to bleeding. And there are some also anticoagulants that have been implicated in renal issues, such as the direct oral anticoagulants, and therefore those are the risks. You're predisposing yourself to bleeding issues and also to renal issues.
The Delta variant is here with us and it's killing people, like it's deadly. So if you have not gotten your vaccine, please guys, it's high time that you just go, because I've seen the government is actually trying. They're bringing in more and more doses. So if you've not been vaccinated, please go ahead, get your jab. We've been vaccinated and we are fine. All those myths, guys, they're not working, they're not real. So please, if you've not got your jab, kindly go get your jab. And then now, Doc, if anyone wants to consult you, where can they find you?
Okay, so our clinic, our anticoagulation clinic, is located in 40 Suites, 3rd floor, room 302. Yes, karibu sana.
I hope this video has been informative. I know it's been informative. So if you like it, give it a thumbs up, guys. And thank you so much. Please make sure you subscribe. Take just a second, it takes a second to subscribe. Thank you so much, and I'll see you on my next video. Bye bye.